I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today we're going to talk about a complicated topic, blood clots, as in DVTs or deep vein thromboses and PEs or pulmonary emboli. All right, so let's take a look at this. First of all, I want to tell you that over the past nearly 40 years of practicing medicine, I have seen many blood clots as both DVTs and PEs. Very, very few of these, like a handful, have been in transgender people on estradiol. So I want to just start out by saying that even though we hear that there's a greater risk of blood clots in people on estrogen, I just want to keep in mind that we don't have the best of research to back us up in this supposition. And so I think that the risk could be overestimated, but let's take a careful look at it. So like I said, we hear that people can be at a higher risk of blood clots on estradiol, but let's take a look at this. What is a blood clot first? Well, a blood clot is also called a thrombus. A thrombus can be either a deep vein thrombosis, that is to say a DVT, which is usually in the leg, but it can be in the pelvis, and I've even seen them in the upper arm. A PE is a pulmonary embolus, and we'll show you how this happens. We're going to look at what are the warning signs and symptoms for both DVTs and PEs. We're going to be looking at who is at particular risk, and we're going to look briefly at what can you do to protect yourself. Okay, so let's review the circulatory system. This is the most important thing. So using the heart, let me just enlarge this slide here. It'll make it easier. So let's look at the circulatory system. So at the right of the slide, when you see your person there, in the very middle of the chest, you can see the heart. The heart is where we're going to use for reference. Blood comes from the heart, and the first place it goes to is to the lungs, or the pulmonary circulation, where it picks up its oxygen, and then it goes back to the heart. It's pumped by way of the big blood vessel, the aorta, to the rest of the body, and through the body, these arteries become smaller and smaller and smaller until they get into the capillary system, where then they change into, or then they meet the veins. And the veins become bigger and bigger as they get back into the heart, as you can see in this drawing, and then the cycle starts all again. All right, so let's take a look at what happens with a DVT or a PE. I really like this picture, but it's complicated, and you may have to look at it a few times. I know I certainly did. So again, let's use the heart as reference in the middle of the chest. Oxygenated blood is pumped from the heart by way of the muscular arteries to a system of veins that have valves, not muscles, to push the blood along. When you have stasis or pooling of blood, this allows a clot to form. And you can see in this drawing, in the lower right portion of the drawing, you can see what's represented as a clot in the midst of a vein. Well, that clot can release, and it can travel north back into the heart. Now, as it travels north through the body, the blood vessels get bigger and bigger and bigger, so that a clot that's flowing through really has free flow until it reaches the heart. Again, it's still flowing freely, but when it goes to its first stop, which is the pulmonary bed, that's when the blood vessels are very, very tiny, and the clot will actually obstruct the circulation at that point. So a blood clot can lodge in the vessels of the leg, or it can free itself and travel to the heart. Remember, there's free flow as the veins get bigger and bigger, and after it gets to the heart, the next stop is the lung circulation, where the veins are very, very tiny. I should say the vessels are very, very tiny, and they are easily blocked. So the symptoms a person has with a pulmonary embolus will depend on the location of the clot and on the size of the clot.